All right, let's listen in.
Since the new coronavirus-related pneumonia occurred, the CPC Central Committee and State Council take it very seriously. General Secretary Xi Jinping inquired on many occasions about the disease and treatment and made important instructions on prevention and control. Premier Li Keqiang repeatedly made important instructions and on January the 20th, chaired the State Council Executive Meeting on further arrangements. Vice Premier Sun Chunlan heard reports and provided guidance on related work. She also spoke at the video conference of the National Interagency Mechanism on the afternoon of January 20th and convened another meeting in the evening of the same day to make further arrangements. The National Health Commission is earnestly following through on the important instructions made by General Secretary Xi Jinping and the important requirements by Premier Li Keqiang and arrangements made at the State Council Executive Meeting. The leading working group has been set up promptly with the principal official from our commission as the head of the group. The group discusses prevention control work every day and sends national working group and expert group to Wuhan. In the principle of jurisdiction management, the group provides guidance on Hubei province and Wuhan city on prevention and control measures. First, trace the source and technical guidance. In a little over a week after the disease was detected, pathogen was swiftly identified as the new coronavirus. Technical plans have been formulated on case treatment, emergency monitoring, epidemiological investigation, and sample testing. Second, we have kept severe cases and fatality at the minimum level. In the principle of centralized cases, experts, treatment, and resources, suspected cases are treated in designated hospitals. For severe cases, one patient, one case is practiced. National medical experts are stationed in Wuhan to provide guidance on treatment. Third, information disclosure and international cooperation. Guidance is provided for Wuhan city to establish a daily public communication system and raise public awareness. We have stepped up information communication with the World Health Organization, relevant countries, Hong Kong, Macau, and Taiwan regions. We have carried out timely and regular exchange of information on technical details with WHO experts. We have also invited WHO and Hong Kong, Macau, and Taiwan experts to Wuhan for on-site visits. As the situation develops, on top of the above-mentioned work, in recent days, we have made further arrangements. First, we have strengthened the interagency mechanism. We have improved the interagency working mechanism led by the National Health Commission and participated by over 30 government departments. The mechanism includes groups on general affairs, prevention and control, medical treatment, research, publicity, foreign affairs, and material supplies. Each group is led by a principal official from competent department with a clear division of labor and close collaboration to jointly ensure effective prevention and control. Second, we have enhanced guidance on Wuhan. We have urged Hubei province and Wuhan city to intensify emergency response. In terms of entry, there have been more strict management of farm markets, a ban on live poultry trade. Wild animals and live poultry are not allowed in Wuhan. In terms of exit, temperature screening is practiced at airports, train and coach stations, and ports. Strict isolated measures are taken on patients with fever and their close contacts, and public gatherings are kept at the minimum level. Third, we have made nationwide prevention and response measures. New coronavirus-related pneumonia is classified as Class B infectious disease according with the law, and is treated with Class A prevention and control measures. It is also included as an infectious disease subject to border health quarantine. Case treatment, prevention and control plans are issued nationwide. The whole country now practices a daily reports system even if there is no new case. the National Patriotic Health Office has made arrangements on winter and spring campaigns themed market environment sanitation. By 12 o'clock in the evening of January the 21st, we have received reports from 13 provinces and municipalities with confirmed cases of 440, death cases 9, new cases 3. All of them are cases in Hubei. And there are reports of new cases, 149 confirmed cases. We received report from Japan on confirmed case, 1 case, and 3 confirmed cases from Thailand, and 1 confirmed case from the Republic of Korea. And a total of 2,197 close contacts have been detected, and 715 patients have been discharged. And more than 300 patients are still under medical watch.
In recent days, the number of cases is changing quite rapidly. It is because we have now a deep understanding of the disease, improved the diagnostic methods, and sent out improved reagents. Our experts believe the cases are mostly linked to Wuhan. There has already been human-to-human transmission and infection of medical workers. There is community-based transmission at a certain scale. Relevant evidence shows that the disease is mainly transmitted through the respiratory tract, and there is possibility of viral mutation and further spread of the disease. During the Spring Festival travel season, there is greater movement of the people, which increases the risks of spread and difficulty of prevention and control, and we must not let down our guard and must be highly vigilant. Going forward, we will work with all other members of the interagency mechanism to follow through on the decisions of the party leadership and State Council and put our people's life and health front and center, and guide the local governments to take effective and vigorous measures in accordance with the principle of jurisdictional management to ensure a stable and harmonious Spring Festival for our people. First, we will take strict measures to contain the disease in Wuhan. We have asked Wuhan city and Hubei province to take strictest possible prevention and control measures to tighten the regulation of farm markets and wild animals. We will ask the public to avoid crowds and minimize public gatherings to reduce the possibility of clusters of cases. We will conduct the strictest possible fever screening, conduct medical observations on those people who have fevers to prevent its further spread. Second, we will keep a sharp focus on national level efforts. We will develop 2 tight nets for surveillance of pneumonia cases with unknown reasons and pre-examination triage at fever clinics so as to timely detect and effectively handle any cases. We will enhance environmental hygiene in this regard, and because of the movement in the Spring Festival, we will put in place measures of ventilation, sterilization, body temperature screening at important venues such as bus stations, coach stations, airports and ports, and also enclosed spaces in vehicles, trains and airplanes. Third, we will provide timely treatment to our patients to reduce fatalities to the minimal level. We will improve the safeguards for the expenses of the patients to ensure timely treatment for the patients. We will also take good care of our medical workers, and in particular for their personal protection and prevent their infection when they are treating patients. Fourth, we will publish information and step up international cooperation. We will disclose relevant information timely, publicly, and transparently, and report objectively the developments and the measures taken by the government, raise awareness about this disease in a pragmatic manner, and on the basis of sound science, and we will take the initiative to step up communication with the WHO, other countries, related countries, and our Hong Kong, Macau, Taiwan regions to share information about the monitoring, investigation, prevention, treatment, and risk assessment to improve our joint efforts in the prevention and control of the disease. Fifth, we will step up research efforts to identify the source and modes of transmission of the disease and conduct targeted R&D and selection of antiviral drugs. We will closely follow the changes in the virulence and the communicability of the disease to make our prevention and control more effective. We will, sixth, arrange for personnel on duty in the health authorities nationwide, instruct the health administrative bodies and medical institutions to send experienced people to be on duty, and all hospitals and disease control agencies at all levels to have enough personnel on the post. We will do our level best to curb effectively the spread of the disease. We have the strong leadership of the CPC Central Committee with Comrade Xi Jinping at the core. We have the institutional strength of a socialism with Chinese characteristics. We have a rather full-fledged system of prevention and control of infectious diseases established since 2003 after the fight against SARS, and we have experience in handling major public health emergencies, in handling H1N1 flu, avian flu, and Ebola, and we have the support of the people. I believe we have the confidence we will defeat this disease. Thank you. Please identify your affiliation when you raise your question.
My question is for Vice Chairman Li Bing. In 2003, SARS turned out to be a public health crisis affecting many countries. What measures will China take this time to curb the spread of the disease? 23 days ago, that is December 30th, 2019, our commission received the report on a viral pneumonia of unknown cause, and we send national group and expert group promptly, and we also made specific arrangements and guidance for Hubei and Wuhan to respond to the disease. First, we made every effort to study how the disease develops. The Huanan seafood market was subject to strict management and control measures, and we have also put patients under strict medical watch. The experts have made prompt studies, and there have been effective work on sample testing and the trace of the source of the disease. And we also made public such information on December the 31st. And on January 8th this year, we identified the pathogen as the novel coronavirus, and we organized consequent work in accordance, including testing and diagnosis. And we have followed the developments very closely and made response plans and measures in accordance with the latest developments, and to keep the severe cases and fatality at a minimum level. On top of the above-mentioned measures, we have also made further arrangements to strengthen isolated treatment and the tracing of close contacts. We have also taken measures to improve the environment of the farm markets in Wuhan and to raise public awareness and to practice temperature screening at airports and train stations. Going forward, the Chinese government and health departments will continue to implement the arrangements made by CPC Central Committee and the State Council, and will work in accordance with the infectious disease law, and to put the Class B infectious disease under Class A management and practice border health quarantine, to implement all the prevention and control measures with Wuhan as a priority, and to effectively prevent and control the disease nationwide, in particular during the Spring Festival holiday. And will step up reporting of disease monitoring, response and information disclosure, and intensify international cooperation and research. The Chinese government and people have the confidence to triumph over this new infectious disease. Thank you.
Next question.
Obviously, with the start of Chinese New Year, there's going to be a lot of people traveling. What efforts, from Bloomberg News, what efforts are you going to take to try and prevent the transmission of the disease from traveling from Wuhan and traveling around China during the Chinese New Year period? And my second question is, a study from British University said that about 2,000 people were likely infected based on the epidemiology of the disease last week. Do you have an estimate of how many people in China are currently affected and haven't seen treatment or haven't been treated yet by doctors? Thank you.
好，问题翻译一下。
我是来自彭博社的记者，我有2个问题。第一个问题是，现在正值春节期间，人员大量流动，那么是否有可能因为人民在不断的从武汉去别的地方旅游而导致更大的传播风险？第二点就是有一家英国的大学研究表示，根据上周的流行病学研究，预计有2000人在中国是受到感染的。那么现在您有没有预测过，就是现在有多少还没有得到治疗的感染人群？谢谢。
这个问题呢是个很重要的问题。
This is a very important. These are very important questions.
第一个问题啊
I will take your first question
接下来啊
and then
我们中国疾病防
ask
控制中心高福院士呢
Mr. Gao Fu
英国大学啊
to take your second question about the research done by British University
疫情啊
and brief you on
说这个情况呢来呢
the current situation of our prevention and control of the disease.
就是结合当前啊新型冠状感染肺炎的防控，针对啊春节期间人群啊流动大的
Because of the
中国政府呢
estimated
将
large
新型
movement of
冠
people during the
感
Spring
染的
Festival, the Chinese
肺炎的疫
government
情防控上升到
takes
国
it
家
very
层
seriously
做出
and
制
has
度性的
upgraded our response to a
果断
national
启动
level.
联防联控的
We
机
have
制
made timely responses and arrangements and intensified our prevention and control efforts. We have established an interagency mechanism with 32 members to cope with
联防联控
this disease.
刚才我已经介绍了
As I just said, there are different
落
groups
实部门的责任
inside this mechanism to deal with different areas of work.
打破部门职责的
We aim to break the boundary of
指挥协调的合一
different departments to create greater synergy
工作的立体化全覆盖
so that our efforts will be multidimensional and more effective and efficient.
国家卫生健康委
The National Health Commission has made arrangements for guidance
强化
for
疫情的
health authorities at the local level to strengthen the
召开
prevention and
全国
control.
卫生健康系统的
On the 14th of January, we convened a meeting
通报疫情
to
防控的情况
report to the health authorities of all provinces the current status, make plans for stricter prevention and control.
到18号
Between the 17th and 18th of January, we sent 7 working groups to Hebei, Guangdong, and other
督导检查
6 provinces
指导防控工作
to offer guidance and instructions.
我们还专门抽调了
In addition,
干部和专家
we have also organized experts and staff of other
推
agencies
进工作的
for inspection and supervision.
1月19号
On the 19th of January, In our response to this disease, we have made further requirements for health authorities across the country for personnel on duty during the Spring Festival. For Wuhan, the National Health Commission Chairman, Mr. Ma Xiaowei, paid a visit to Wuhan on the 15th of January to instruct the local authorities to better respond to this disease. First, on the outflow of people at the airports, couch stations conduct fever screenings. So far, the Tianhe Airport of Wuhan has set up 15 screening devices, and at the stations there are also relevant equipment. And second, we have strengthened the regulation of the source of the virus. On the basis of tighter regulation of the farm market, we have strengthened regulation of supermarkets and restaurants, and we have cracked down on the transaction of wild animals. Third, we have enhanced the management of the people, and fourth, we have conducted patriotic health and hygiene campaigns. To curb the spread of the disease, the Wuhan government has, on the 21st of January, made a call on the people. Through the media, I think you have known that. That is in principle. Unless for essential reasons, they suggest that people outside of Wuhan do not go to Wuhan, and Wuhan residents don't leave Wuhan. This will reduce the movement and reduce the risk of transmission. About the provinces where cases have already been found, we have suggested that they step up their control and prevention for the early detection, reporting, isolation, quarantine, diagnosis, and treatment. Early is key. We have also mobilized medical resources and conducted tracking and the biosafety of labs. Third, national hygiene campaigns to mitigate the risks of transmission. For those provinces where cases have not been found, we have asked the health institutions to improve their contingency plans and prepared the negative pressure ambulance and hospital rooms, treatment supplies, testing equipment, and personnel preparedness for potential diseases, potential cases, to ensure that once there is any case, they will be handled effectively and immediately. With these efforts, we will minimize the cross-regional and cross-border spread of the disease during the Spring Festival. On the second question, I will give the floor to Mr. Gao Fu, friend from the media. This is a very good question. This question, I think, is based on science. I have looked at the results of the study that you mentioned. It was done through mathematical models, and the number was the maximum of the upper end of the range estimated. And you know that when there is a new disease, we must base our judgment on facts, and theoretical hypotheses are another thing. We welcome more insights and more models. There are a lot of models. Whether these models conform with reality, actually, in the previous speaker has already briefed you on the measures taken. Based on your knowledge about the disease, you will be able to understand the study better. And I think the reality we are facing is not in line with the study that you mentioned.
I want to ask whether you can give us more detail on why the number of cases has risen so sharply in recent days. What specifically were the new testing measures that you brought in? And also, can you please comment on whether we have any indication of how serious this is, how serious the virus is compared to SARS or MERS at this point?
好，请翻译一下问题。
路透社记者，我有2个问题。首先，您能不能透露一下更多的细节？为什么近几天确诊病例的数字激增？是不是因为采取了一些新的检测措施？另外呢，您能不能通过跟非典 SARS 以及 MERS 中东呼吸综合症进行比较一下，这次的这个病毒是更严重，还是请做一下具体的比较，谢谢。
好，这个问题啊非常专业。
Well, this is a very professional question. I will refer this question to academician Gao Fu.
刚才其实呢，记者朋友在这个提问题的时候呢，同时也给出了。
Well, actually, in your questions, actually, you mentioned part of the answer. That is the new testing measures. That is part of my answer. As it was mentioned in the opening remarks and in my previous answer to the questions, well, there have been models and previous knowledge. All such information is based on knowledge and human wisdom. It's a fact that there has been an increase of the confirmed cases, and we are gaining more knowledge about this virus. At hindsight, we can see that science gave us effective tools. Just now, Vice Chairman Li said that after the virus was detected, we made professional arrangements and promptly identified it as a new coronavirus, and promptly we figured out the genome sequence, and promptly we identified the virus strain. And all this demonstrates the progress in China's response to infectious disease, in the level of professionalism and the scientific knowledge. As we gain more and more knowledge about the virus, as many people, including the journalists, are interested in the comparison between this new virus and SARS and MERS, there are altogether 7 identified coronaviruses, and 4 of them are quite serious, including SARS and MERS. And we are still gaining more knowledge about this virus. Thank you. From China Daily. There are confirmed cases of healthcare workers. Can you give us more details, and what measures will be taken to protect the health and safety of the health workers on the front line? Well, the whole society follows this very closely. As for the health authorities, we also take it very seriously. And I will refer this question to Vice Director General Jiao Yahui of the Medical Management Bureau of our Commission. Thank you for your question. Recently, according to the reports on the WeChat account of the Wuhan Health Commission, there are confirmed cases of healthcare workers, and the press briefing with the health experts, academician Zhong Nanshan, also mentioned human-to-human transmission and infections of healthcare workers. We are saddened by such infections. As we know, healthcare workers, they face high risks of getting infected. After the disease occurred, they have been working at the front line day and night, at least for more than 10 hours every day, And of course, they wear the protection gears and device, but we can see that they work very hard and the whole body has a lot of sweat. And we want to pay tribute to all those who are working very hard in the hospitals. And such infections show evidence of human-to-human transmission and also expose the loopholes in the prevention of infections. Of course, as academician Gao Fu mentioned, we are still on the learning curve regarding the virus. The disease will continue to develop. It has developed different features compared with the early stage, and the prevention and precautionary measures need to change accordingly. And we have taken measures to address the weaknesses in the protection systems. And we are revising the standards and norms to protect the medical workers. And we have also taken more strict measures in the hospitals to protect the health workers. And in light of such infections of health workers, we will intensify training of healthcare workers nationwide. We want to draw attention to all healthcare workers, not just in the related departments, but also in departments of other diseases. Every healthcare worker needs to be aware of the prevention measures. We will make sure that patients will be effectively treated. At the same time, healthcare workers are effectively protected. Only we effectively protect the health workers can they work at the front line to treat the patients.
Next question.
你好，我来自新加坡联合早报。我们看到这几天的确诊的病例有激增的这样的一个现象。
We see a sudden increase of confirmed cases recent days. So is there any problem with information disclosure at the early stage?
是否存在的一些瞒报的这样？
Was the government hiding something from the public at the early stage?
由我们应急办的主任许树祥同志。
I'll give that question to Mr. Xu Shuqiang.
那个李斌副主任呢？
Vice Chairman Li Bin has already emphasized that we attach great importance to information disclosure, which is very important. After the occurrence of the disease, the National Health Commission instructed the Commission in Wuhan on the 31st of December 2019 and the 3rd and 5th and 9th of January 2020 published relevant information. And since then, we have been disclosing information publicly every day about the cases. And in recent days, cases were reported in places outside Wuhan, in Hubei, in order to provide timely, accurate, and comprehensive information to the public. From the 21st of January, the National Health Commission puts together and publishes all the numbers of confirmed cases and suspected cases of all provinces every day. You can see such information on the website of the National Health Commission. This system of daily reporting will be carried forward, including during the Spring Festival, until there is no need for that. Thank you. Next question.
谢谢主持人，我是澎湃新闻记者。我们知道，当年 SARS 产生了超级传播者，导致了这个疫情
saw some super spreaders, which exacerbated the spread. And yesterday, there were rumors about 4 medical workers who were super spreaders. Is it because of the mutation of the virus that there has emerged super spreaders which may set off a large-scale spread, will this disease become another SARS? I think friends from the media are very interested in the technical details and have raised many professional questions. And I will ask again academician Mr. Gao Fu to take your question. This is indeed a very good question. If you are interested, you can read papers in this area. For example, Transit Microbiology carries my articles about this several years ago. There were no such coronavirus, and there were no study about the relation between superspreaders and diseases like MERS and SARS. We are still in the process of learning more about this disease. So far, we have no evidence to support the idea that there are already superspreaders. For example, MERS in the Middle East, there has never been any reports of superspreaders, but there were cases of superspreaders in the Republic of Korea. Otherwise, there wouldn't be over 100 cases. It is a question about science. We will keep following the developments very closely because based on our expertise, we see the possibility of superspreaders, and we are taking relevant responses. It is a very good question, and it is a very important direction for our future prevention and control.
你好，我是东塔斯社记者。请问中国和俄罗斯的边境线非常长。
So China and Russia has a long border. To prevent the spread of the new coronavirus pneumonia, what measures has China taken along the borders with Russia? And is there any contact between the two countries on this matter? Could you give us more details about international communication and cooperation? Well, let me answer your question. About the nationwide prevention and control, it also includes the border areas. I mentioned this in previous remarks. And what we need to do now is to implement well the prevention and control measures for early detection, earliest possible reporting, quarantine, diagnosis, and treatment. Effective implementation of these measures will help us curb the spread of the disease. At the same time, we have also intensified control of the disease. Now we have put this infectious disease of Class B under Class A management. Our Commission also put a notice, I believe many of you have noticed. In accordance with China's infectious disease law, we have made the principle of putting this Class B infectious disease under Class A management. And the second principle is made in accordance with international quarantine law, that is, this infectious disease will be subject to border health quarantine, and we have intensified quarantine at ports of entry and exit. In terms of international cooperation, let me say the following. First, after the disease occurred, in the principle of transparency and openness, and a high sense of responsibility toward global health, China has promptly made reports to WHO, Russia, and other related countries, and Hong Kong Macau, and Taiwan regions. As of January 20th, we have exchanged views for 15 times. And second, we have maintained close communication with WHO. Chairman Ma Xiaowei had several telephone calls and exchanged letters with WHO Director General to give him updates and latest information. And we shared information first time, the strain and the germ sequence with the WHO. And we have had in-depth technical exchange and discussions with WHO experts. And 4 such expert meetings have been held. We have invited experts to Wuhan for on-site visits to learn more about the virus and the disease. Third, we have intensified communication with Thailand, ROK, Japan, and US, and their competent authorities and embassies in China. We shared information with them, including information on suspected and confirmed cases to respond to their concerns. And fourth, work on Hong Kong, Macau, and Taiwan. On top of regular work, we have also invited experts from these 3 regions to visit health institutions in Wuhan and have in-depth discussions with local healthcare workers. And upon the request by Hong Kong and Macau, we have provided free treatment and diagnosis for dozens of cases from Hong Kong and Macau. Next question, please. From Economic Daily, how can the general public prevent from being infected if a person is highly suspected as being infected? What kind of medicines can help treat the symptoms? And if such symptoms are confirmed, are there designated hospitals or clinics to treat them specifically? And will there be designated facilities for such treatment? Or this topic has been followed closely by the general public with keen interest. And I hope that friends from the media will help us raise the publicity and public awareness. And I will refer this question and knowledge to Madam Jiao Yahui. Well, thank you for your question. For every person, we are all very concerned about how we can protect ourselves from such a disease. My advice is that don't go to densely populated places, either at home or in workplaces. Be careful about ventilation and open windows regularly to let in fresh air. And if there are symptoms of fever and cough, wear a mask. That is a mask etiquette and cough and sneeze etiquette. Please cover your mouth with your hand or flexed elbow when you sneeze or cough. This is a protection for yourself and for other people. And wash your hands regularly, especially if you cover your mouth with your hand when you sneeze. Wash your hands. Don't rub your eyes or touch your mouth with your hands before washing them. And if you have symptoms of cough and fever, our advice is not to take medicine without medical prescription, or just refer to online information and stay at home without visiting the hospitals. As things stand now, go to the hospital, ask for professional advice from doctors. At county and municipal and provincial level, for hospitals at or above the second level, there are fever clinics. Either you visit general clinics, outpatient, or fever clinics. There are professional healthcare workers to take your temperature and give you a mask. And screening and testing will be conducted at fever clinics. Of course, we are in a season with the high outbreak rate of other respiratory diseases. If there are cases of highly suspected symptoms, there are specialized equipment and device for treatment and screening. And preliminary screening will be conducted and detailed records will be made at the hospitals and clinics without treatment conditions, and such cases will be transferred to hospitals, designated hospitals with treatment facilities. And provinces and municipalities have all designated general hospitals for special treatment, and there are backup hospitals if the demand increases. And detailed contingency plans have been formulated. Back in 2003, when SARS broke out, in Beijing, we have the Xiaotangshan Hospital, a designated hospital especially established for treating SARS. And if and when this virus develops to such a level, we will take similar measures. But of course, the virus or the disease is far from that level. We have sufficient medical resources to provide timely treatment to patients. Thank you.
你好，香港大公文会的记者。我有一个问题，现在网络的传言很多，请问现在武汉真正的情况是怎么样的？
Situation on the ground in Wuhan. Is there the possibility that people may not be able to get into the hospitals? Do you still suggest people to go back to Wuhan to visit their family during the Spring Festival? Just now we have talked about this. It takes a process to understand this new virus. And this process must be based on sound science and the developments of the disease, and adjust our various measures for treatment, diagnostics, and prevention and control accordingly. In recent days, there has been a big increase in the number of cases in Wuhan. After we identified this new coronavirus, we have improved the reagents and testing methods, making it quicker to detect the disease. But all these is a process. As we continue to improve our work to be used for clinical uses, we will be more efficient in the defect detection. According to epidemiological analysis, the Wuhan authorities have expanded the scope of case searching and provided timely treatment and diagnosis for them. And we have also published relevant information in a timely manner. So, as to keep the public well informed about going to Wuhan, that is a question of interest for many. Just now I have said that the Wuhan government has made the call through the media suggesting people not to go to Wuhan unless necessary. Because over 90% of the cases are in Wuhan, and there were confirmed cases of medical workers' infections, and there is community-based transmission of the disease at a certain scale. The disease is transmitted through respiratory tract. There is possibility of mutations, and there is risk of further spreading of the disease. Recently, the head of the high-level expert group of the National Health Commission, Academician Zhong Nanshan, also said that the disease had an outbreak in Wuhan, and the focus of our control and prevention is still in Wuhan. As a scientist, Mr. Zhong has suggested, for the sake of the well-being of everyone, for everybody not to go to Wuhan, and Wuhan residents not leave Wuhan. These are the advice from Mr. Zhong, which shows his sense of responsibility to stop the spread of the disease. The Wuhan government has said on the 21st of January, calling on people to avoid going to Wuhan unless they have to. And if there is no special circumstances, they suggest Wuhan residents not to leave Wuhan. This will reduce movement and travel and reduce the transmission and alleviate the pressure on prevention and control, which fully demonstrates the Wuhan government and Wuhan people their sense of responsibility and mission in curbing the disease, and also their determination and confidence in triumphing over the disease. Thank you. Just now, Mr. Gao said it is still a learning process. Do you have knowledge about the source, the incubation period, the dangers of this disease, especially how dangerous it is for different populations, for example, young people? Just now we have said that we are still in the process of learning more about this disease. In several aspects, we see the commonalities between this virus and other coronaviruses. We are able to build on the knowledge we have gained in the past, human beings have gained in the past. But this disease and this virus has also shown some new features, including the source. We have already known that this disease originated from a market which conducted illegal transaction of wild animals. This might be the cause. So the disease could be on an animal and then passed on from this animal to human. And second, this virus is adapting and mutating. I think you have watched Catch Me If You Can, a Disneyland movie, Tom and Jerry. And you see that there is evidence for human-to-human transmission and community-based transmission. So there are 3 stages of transmission. Our judgment is the origin was the exposure to wild animals at the seafood market. And this virus is also adapting, which is in line with the human knowledge about coronavirus. But as time passes, we still need more analysis on this virus. As you just mentioned, perhaps it is particularly dangerous, according to current epidemiology, might be more dangerous to young populations, children.
Last question, please. Thank you. From Beijing Youth Daily. We've been stressing the disease is classified as Class B disease and managed as Class A. So what specifically does it mean, and what are the level of response as an emergency?
Thank you. I will invite Mr. Xu Shuqiang to talk about this. Just now, Vice Chairman Li has already talked about that we are now at the most critical stage of prevention and control, and the State Council has already classified this disease as a Class B infectious disease under Class A disease management, which means it requires prevention and control measures designated for Class A diseases, which means all local governments, departments, and medical institutions at various levels can conduct fever screening, isolated treatment, quarantine for those who had close contact, and other strict prevention and control measures in accordance with law in order to effectively curb the spread of the disease. About the level of response, on the 20th of January, Hubei government published a notice and decided to trigger Tier 2 response to public health emergencies. The provincial government will be coordinating such efforts. After the trigger of this response, they can mobilize all the resources, personnel, vehicles, supplies, and other facilities, conduct on-site quarantine and enclosure of certain zones, and ensure the supply and funding for prevention and control, and organize the patients and people who had close contact for their quarantine and dispersion of crowds. They will also be able to inform the public in a timely manner and ask for support from the State Council to ensure effective prevention and control. Thank you. There has been a lot of media attention on today's press briefing, so before we conclude, I would like to say that the central leadership of the party and the State Council take it very seriously to tackle this disease, and they have always put the people's lives, health, and safety front and center. We believe under the strong leadership of the CPC Central Committee with Comrade Xi Jinping at the core, with the concerted efforts of all departments and local governments and all medical workers, including the resolve of the people, especially people in Wuhan, we will be able to defeat this virus. And I would also like to emphasize that we will uphold transparency and openness and publish relevant information timely to respond to the questions by the public, and we also hope the people will not believe in or spread any rumors. I know you have more questions. We welcome such questions from you. You can send them to us or the National Health Commission Information Office. This will be the last press conference before the Spring Festival of the State Council Information Office, and I would like to pay my tribute to all those medical workers who are on their post and I want to say to the people of Wuhan that we are always with you and wish you a very happy Spring Festival and Happy New Year. And I want to thank all the speakers and thank all of you. Thank you.